Hello, my name is Kevin Say. I'm an IoT solution architect here at Microsoft. I help partners and customers make IoT reality. I have the best job at Microsoft. Welcome to the Microsoft IoTInAction webinar series, where you'll have a chance to hear from the broader digital transformation on how it's changing the business landscape across key industries. On today's webinar, we're going to focus on how Microsoft and our partner HCL IoT Works is improving outcome with IoT in the health industry. I'm excited to be joined by one of our healthcare industry experts, Gareth Hall. We also have the VP of HCL IoT Works, Dr. Aditi Banerjee. And lastly, Microsoft's Cameron Carr, IoT Director of Strategy and Solution at Scale. Our first guest is Gareth. Welcome, Gareth.
Hi, Kevin.
Tell me about your role at Microsoft and how you came to be here.
So I have the honor of leading the health solutions team for Microsoft's global healthcare team. And I know you said you have the first job or the best job at Microsoft. You have the second best job at Microsoft. My team gets to spend time with customers and partners, and actually really interesting in the Microsoft product teams, and help us all work out how we deliver solutions that make a difference to patients' lives, help partners grow their businesses, and really help Microsoft to help our customers transform healthcare.
So for this particular series, we're talking about connected healthcare. Yeah. Tell me about connected healthcare.
It's really interesting. If you think about you as a patient, I'm willing to bet that your experience of healthcare is not being a joined-up, connected experience. Is that a fair statement?
That's a very fair statement. Maybe an understatement, but spot on.
Indeed. And the really interesting thing is most patients think that healthcare is joined up and connected and beautifully works like many other segments and interactions that they have in the world. What they don't realise is it isn't like that. Healthcare is separate and disparate, and there's different systems to do everything in healthcare. Even where you think there would be a simple solution to solve a problem, it's actually quite hard for compliance reasons and cultural reasons for healthcare to transform in that way. When we see healthcare connect both providers and patients and pharmaceuticals and the payer industry together, you can have a so much more efficient connectivity. You can have patients that can improve their own healthcare. And the really cool thing, and we're starting to see this happening in our customers, is we can move them from illness to wellness and health, which is so important for us.
Well, that's interesting because right now I have to be honest with you. When I view my healthcare provider, I only think about them really when I'm sick.
Yeah.
Or my family's sick or they have a need, right?
Yeah.
It's not proactive, it's not wellness, it's I got a problem.
Yeah.
Right? So certainly you're right, that's key, that's a problem.
It is.
Definitely.
It is.
Definitely.
And it's funny, I used to work for the National Health Service in the UK, and my chief exec was amazing. He used to start all of our board meetings with, let's remember, we work for the National Illness Service, not the National Health Service. Let's change that.
Oh, wow.
That's our job. That's your job as a patient. That's all of our partners and customers' job. We can really start to transform both illness, which is really important, but actually start to really increase the wellness focus by connecting people, systems, providers together using technology that the rest of the world is starting to use and actually make a difference.
Well, that's a good point because you're right. I think about, illness or I've had a problem, right? But I don't want to forget about that. When I have a problem, I want to have it solved, but I want to prevent it.
Yeah.
I want to do things up front and address the cost problem, right? And problem's the word I might use there.
Yeah.
Certainly. So size up the problem for me. Help me understand what's happening.
So the world can't afford healthcare anymore.
Agree.
And
I can't personally.
No, and it's really interesting. In the States, that becomes a personal question. In other countries of the world, that becomes a government or society conversation.
Yeah.
Whole countries can't afford healthcare. But patients don't want to reduce their healthcare service. Understandably, it's really important to them.
Yes, sir.
How can technology help reduce that cost and keep the service the same or start to increase it? Think about chronic disease, particularly with an aging population. We know if you think about the numbers of people, everyone you know, you think about the society we live in most countries it's aging. A huge proportion of the cost of healthcare goes to a small number of chronic diseases for a relatively small part of the population.
Oh, wow.
Those chronic diseases are the things that need to be connected. Think about if you're a diabetic or you've got congestive heart failure, what do you need? You need to be monitored constantly. You want to have to be connected so that your provider knows that things are okay or not okay.
Yep.
Healthcare doesn't really do that. We bring you into hospitals.
Yeah.
Where's the most expensive way of delivering healthcare? Hospitals. Should you go for a diabetes test to a GP or to a hospital? Probably not. There are cheaper ways of doing that.
Yeah. So you're certainly hitting all the things that make sense to me, right? My family's getting older. It tends to happen, of course. My father is diabetic. And you're right, we need to look and understand that. And for him to go to a hospital every day or a periodic basis doesn't make a lot of sense. I'm not a patient man. He's really not a patient man. So that doesn't make a lot of sense. And you're right. The adage is that you don't go to a hospital because that's where all the sick people are,
Yeah,
right?
absolutely.
Why would you make that happen, right?
Yeah,
so, but you're spot on. Is a problem we have to address. They're getting older, and as we get older, right, they live longer. It's kind of the definition.
Yeah.
But my father lives alone, so he doesn't always have people there to monitor, make sure he's doing the things he needs to do.
Yeah.
That's huge.
Yeah, it is. And huge is the word. Everything to do with healthcare is big. Lots of employees, lots of data. The data thing's a really interesting challenge because you could connect every patient to sensors and have them reporting. Imagine if you're a physician and you manage, I don't know, 2,500, or you're a care team, you've got 2,500 patients that you look after. Do you want 2,500 pulse readings, blood pressure readings, diabetic readings from those people hitting your screen every day?
No.
You need a system that takes that data, once we start to get these people connected, and starts to apply analytics and intelligence and thresholds to tell them there are trends that are changing or that there is an issue about to happen. And that's the dream for healthcare. How do we get to the point where we can use this data and start to think about what's happening next? Healthcare is all about rearview mirror, and that is a real shame.
Oh.
We know you were ill.
Yeah.
It's really hard to tell you're going to be ill. And the power of the cloud finally gives us the compute power to do this kind of predictive analytics and start to say, actually, the risk of readmission, which is really expensive for a US hospital to do, is higher for patient A or B. Let's do something different. Oh, wow. Or the risk of mortality. I mean, that's the end point of this. This is a really serious conversation. Can you use analytics to reduce the mortality and the cost of the patients that you're treating? Yes, you really can. And you need the data from the sensors and the systems around that patient to connect those things together.
I think you're spot on the fact that, when I think about other IT systems, right, I wanted to prioritize.
Yeah.
Look at the top concerns I have.
Yeah.
But I can't prioritize unless I have the supporting data.
Yeah.
And then from a maturity go beyond that, wouldn't it be great to predict? Yeah. Or to trend and understand the differences, right?
Exactly that.
That's amazing. And you're right. My doctor's never called me.
Nope.
Well, the only time they do call is to tell me my test results are in, right? All kinds of stuff.
Backwards looking.
Yes, sir. Certainly. I've never, had them call me or interact like that.
Yeah. And the thing that makes healthcare really challenging, because these are obvious things. You would do this.
Yeah.
It is hard to do it in healthcare. It's a regulated industry.
Yeah.
You care about your patient data. I care about my patient data. When I have patient data flinging across the network from people to systems, you've got to think about that. And that compliance and regulatory environment that these guys have to operate in makes things complicated. We're seeing massive changes. At last, we're seeing healthcare jumping into the cloud. We're seeing our partners building cloud solutions. We're seeing our customers across the whole world, US and US and particularly Europe, actually, are really starting to drive this forward. That compliance thing it used to be a barrier. Now it's just a thing that they can work around and that they can do these things, transformational activities, and do it safely.
Yeah, I know when I've interacted with a lot of my healthcare customers in the past, right, the word HIPAA come up and compliance, and I spend, hours and hours talking to security people, but you understand that they have financial penalties if they don't adhere to it. So you understand their point of view, and you're right, it's been a barrier to adoption, technology, evolution, whatever words you want to use there.
Yeah.
And it's great to see them come together, to say that we have the compliance, we've checked the boxes, we do those things, but yet we can still harness the power of the cloud.
Yeah, and compliance is it's a technology thing, but it's a process thing. We have an amazing set of compliance statements and guidelines that we do on our cloud, and we help our customers take our platform, understand what they have to do to understand their HIPAA or EU model clauses or whatever it is to do that. And that's a partnership between us and our customers and our partners to deliver safe healthcare information in the cloud.
So let me get selfish for a second here. How does this help from a cost perspective? How you or Microsoft or the industry are going to help lower my costs? Because I seem to be going up.
Yeah, and it's about this is about the change in the way that the patient experience is happening. Think about it today. We talked a little bit about earlier. It's disconnected, it's reactive.
Yeah.
You do illness, you don't do health. The panacea, the way that we're moving with connected devices and sensors that feed analytics and performance behavior and what's called clinical decision support. For a clinician, wouldn't it be great to say, hey, you're about to do A, the data tells us that if you do B, you're likely to have a better success rate.
Oh, wow.
Completely doable today. That connected patient experience that has all that data streaming back is A, quicker for the patient. Removing latency is great. Healthcare frustrations for patients are always, why do I have a test, wait for a week, another week to sort the doctor? How can technology stop that latency?
Yeah.
And then particularly in developed world, the way that healthcare systems are paying hospital providers these days is to improve the outcome, not pay them for doing the activity. So if you're a healthcare provider in most of the world today, a few years ago, you'd get paid to do as many operations, as many treatments as you possibly can.
Okay.
We all know what that leads to.
Yes.
In health, we call it the perverse incentive. They're now moving to this thing called value-based care that says, we're going to pay you, Mr. Provider, for the outcomes that your patients experience.
Wow.
Whether that's mortality rate or readmission rate or anything that is an actual performance measure rather than an activity measure. So as soon as you start to do that, you drive this interesting behavior change. If you're a payer and a provider, you can build this relationship that says, we can save money and we can increase the outcome for the patients. That's a really powerful time we're in.
It seems like we have a shared goal now, right? Is about my better health.
Yes.
How many times I undergo a procedure?
Yeah, exactly.
Right? That's where we all want to be, right? That's a win-win-win for everybody.
Yeah, no one loses for that. And again, I know this is an IoT series. This is genuinely a key part of this conversation. You can't do predictive. You can't do outcome-based stuff unless you know what that patient is doing and what the data is. You've got to be connected to them somehow. And that's what these technologies finally are letting the world start to do.
And you're right, you know, and all the things I've done, not healthcare, but the other industries I've been involved in, the more data you have, the better decisions, the better predictions, classifications, all those kinds of AI and machine learning technologies, right? The better the experience is.
Yeah.
And you're right, when we have siloed data sets, right, in my little data center, kind of stuff I can hug and squeeze every day, right? That's great at that small silo, but that doesn't help from a global perspective.
No, it doesn't.
And definitely when I go to multiple healthcare providers, right, for different reasons.
Absolutely. You're on holiday and you hurt yourself. Wouldn't it be good if they could talk to each other?
Could not agree more. So kind of walk me through the evolution, I guess, right? Where are we? Where are we going? 'Cause you keep mentioning backwards looking, that's fine, but how are we going to get forward looking?
And this is one of our most interesting conversations we have with all of our customers. They spend, most IT spend today goes on big, what we call electronic medical records or electronic health records. They are the system of record that run, they've got your patient data in the States, they've got your billing data. They are how you run your business. There's a really interesting stat from the industry that healthcare is the only industry where technology has reduced the productivity of its employees. Think about when you're with your doctor. Does it feel like a really seamless use of technology that somehow makes your consultation quicker and more effective?
I'd say it's just the opposite. I'd say when I go in there, my doctor is staring at a screen. It takes a while till he or she finally looks at me. And then they probably ask the same question the person before asked as well, right? It is disconnected. Now, I understand, I assume for regulatory reasons, they have certain things they have to do. But I would say the FaceTime, like you and I are talking right now, has been lesser.
And even if you're in the same room, you're right. In the old days, there used to be a big screen between you and the your practitioner. At least now they're on better devices, they're on smaller devices that don't get in the way. But that clinical system, that record, is huge. We're not saying it's not hugely important. It's the foundational building block of how you do health IT. We got it. But you can layer things around it that give you either systems of insight. Wouldn't it be great if they had predictive analytics based on that data that your practitioners just spent the whole time typing in?
Certainly.
That would be really cool. Wouldn't it be great if you could use a system of engagement to connect your doctors together? So let's say you need a specialist referral. Wouldn't it be really cool if your doctor could have a look at the presence indicator of 5 other specialists in his hospital all around the world and have a quick, secured, HIPAA-compliant conversation with those guys and ask them that question rather than running a whole healthcare process of, I'm going to refer Kevin to a specialist. It's going to take a month. We're going to then take a period of time to find those specialists. I can get a quick answer in a secured, compliant way to remove some of that latency. Those systems of insight and those systems of engagement build on top of the core system of record building block from amazing Microsoft partners who sell those things. But you need all 3 of these things to really transform healthcare.
Certainly. You know, when I think about referrals, it's happened before, right? I feel like I start over. I feel like, hi, my name is Kevin again, and I start over. We do blood pressure, all those things, right? You're right. As I think more and more about it, connected is not the word I would use, right? Disconnect may be a better word. But I feel like I start over, which is inefficient, which is just the topic we're hitting on here, right? And I feel like I start over. And the rest, go ahead, please.
And it's really frustrating for the practitioners. Can you imagine if in your job, everything you had to do in your job, you had to ask the same questions that you know someone else had asked yesterday? It would be so frustrating. They don't want to do that. Technology should help them solve that problem, whether that's the clinical system itself or the system of insight or engagement around it, or the data that's coming from connected patients and systems across the healthcare solution. That should help them solve that. We want to make doctors and nurses more efficient because they're a pretty rare beast these days. There is a shortage of doctors and nurses.
Did you just call a doctor a beast?
Yes.
Okay.
With all levels of respect.
Yes, of course. You're right. But from a workforce, there's fewer and fewer of them in certain scenarios, right? Especially in developing countries, right?
Yeah.
So, I've noticed that change is starting to happen. The online tele experience, right? Clearly to address cost and or availability of resources, people, right?
Yeah.
So, totally get it.
And this brings us into the other sort of subtlety around healthcare. There's the compliance regulatory piece, and then there's the, we'll reverse this.
Yeah.
So you're a patient. Who do you want to decide what your healthcare future is? Do you want a computer, or do you want a doctor that went to medical school for 12 years?
I probably want a doctor at medical school, someone who understands, and because my health is probably not binary.
There you go. And it's different to it. You said your dad had diabetes.
Yes.
He will be different to every other diabetic patient in the world in some way. Now, the really cool thing is we've all realised as an industry that artificial intelligence and machine learning based on data from IoT sensors around the patient can assist physicians. There is no way physicians and nurses will ever get replaced by this stuff. We can assist it, we can accelerate it, we can remove noise, we can help them think about the future rather than the past, but those clinicians are still absolutely critical to this process.
Yeah.
We just want to make them more efficient. Can they see 50 patients a day rather than 30? Can we help them make faster cost decisions or more holistic decisions that help them understand the cost and the outcome? That's what data's supposed to do. It doesn't replace these important people, it just makes them more useful.
That's an interesting point. I was watching a video recently about AI and the concerns of it, right? Cyborg or Terminator, you use whatever term you want, right? But that's not the case, right? It's to help make decisions in those kinds of scenarios, not to make decisions for you, right? Yeah. And back to my example, they take my blood pressure every time, right? Wouldn't it be great if all of that data were already there and if I were trending to a certain level?
Exactly.
They called me to come in not because my blood pressure is bad, but I'm trending in the wrong direction.
Yeah.
Taking the wrong medications, those kinds of scenarios. Exactly.
And all of those things that you've just described are perfect examples of transformation in health. So I'll say this carefully, the whole industry, the whole world talks about digital transformation.
Yeah.
But we think about it slightly differently at Microsoft. And the reason we're confident this is the right way of doing it, I'll tell you in a minute. But we think about how do you engage your patients and your customers.
Got it.
How do you empower your care teams and your employees?
Okay.
How do you optimize the clinical and operational effectiveness?
Okay.
And then how do you do all of those things together to actually transform the business of delivering healthcare?
Wow.
And it's really interesting. The thing that I said I had the coolest job in Microsoft. We get to meet 50 or 100 customers every year that come to our executive briefing center here in Seattle. And it's amazing. A large proportion of the strategies from our healthcare customers fit into those 4 buckets. They probably use different words, but they absolutely align into those 4 buckets. So those 4 areas of transformation that we see from our customers and how we're thinking about how we help our partners and our customers transform make sense for us, they make sense for our partners, they make sense for our customers, and actually, most importantly, they actually make sense for patients. And I think that's such an important thing. Let's never forget, if we do our job properly and our partners and our customers do their job properly, my dad, your dad, is going to have a better outcome.
Great. Because as we talked earlier, right, they're getting older, they need other additional cares that show up. You're right, the current system with the strengths and weaknesses, right, probably won't scale, I hate to use that term, but won't work for what they're trying to do.
Yeah. I won't name them, a European country recently who said if healthcare demands continue at the same rate they're doing, 30% of their population are going to have to be employed in healthcare in 10 years.
Wow.
Now,
that's huge.
Healthcare already employs a large number.
Yeah.
No country can afford 30% of its entire workforce working in healthcare.
Wow. Had not thought of it that point of view. Very, very interesting. And it's great with your role at Microsoft and the customers that you meet that it's a pretty consistent story.
Yeah.
It's not a one-off, so it seems like more of an industry opportunity.
It is. It's an opportunity globally. It's an opportunity for all of healthcare, payers, providers, pharmaceuticals. If you connect those 3 things together with data, we can really start to see some changes. And there's a trend as well of health becoming increasingly collaborative. Yes, there's elements of competition all over the place, but think about what medical doctors are. They're academics. They have to, if they want to write a document to change the care pathway or a procedure, they get it peer reviewed. They are trying to work with all of their colleagues to transform the health of a patient or a condition or a country. That starts, technology enables these people to do this at a global scale rather than just with the 3 doctors that sit next to them in their department.
But still honoring the things such as security, privacy,
absolutely.
and those things that have been, I would say, barriers in the past.
Yeah, absolutely.
Great. Amazing to see the transformation. And you're right, not to overuse that word, but the transformation of where that's going. So great stuff. So great conversation. When customers, partners, providers, patients have more questions, want more information, where can they go to get information about that?
We've made this simple. www.microsoft.com/health.
Very simple there. So you weren't hiding it from me.
No, not revolutionary. We thought we might want to share some of these stories. So if you go there, if you go there, you can find out how the technology works. Most importantly, you can find out how customers make a difference with this stuff. And the customers, partners, might learn something just by seeing what other people do.
Give me an example of someone who's doing this maybe the right way or moving towards that direction.
That's one of the most reassuring things for us. We're seeing cloud taking off. We're seeing IoT taking off. And actually, I'm going to do better than that. I'm going to refer you to Dr. Banerjee, who's going to come on after me, and she's going to talk about how HCL and IoT Works is doing this in the real world, and she's going to be able to give you some specific examples of the impact they're having with our health customers globally.
Great segue, and appreciate it so much. Coming up next, it's my pleasure to introduce Dr. Aditi Banerjee, the Vice President of HCL IoT Works. Welcome, Aditi, and how are you today?
I'm doing great. Thank you, Kevin. It's a pleasure to be here.
Tell me a little bit about IoT Works and your experience.
I'm the Vice President of the IoT business at HCL, focusing on the healthcare market. My primary responsibility is business development in medical devices, pharmaceuticals, and the healthcare space. HCL IoT Works enables enterprises to leverage best-in-class IoT solutions, create IoT platforms for maximizing returns from their asset, and create new services that deliver measurable business outcomes. So that's what we are all about in IoT Works.
Great, wonderful to hear that. So we heard earlier from Garrett about some of the challenges. We kind of were talking back and forth. Tell me about some of the solutions that IoT Works has delivered to solve some of them.
You know, IoT Works primarily brings solutions which are based on IoT technology, which is with sensors, cloud, and analytics. This IoT solutions can be applied to healthcare in many different ways to address the challenges of healthcare, which is mainly cost and quality of care.
Certainly.
The connected and intelligent system is gaining traction in healthcare, aimed at providing advanced care to patients at low cost. An example of such a system is remote patient monitoring, which is the next generation cutting-edge IoT solution. It works on improving patient outcomes while enabling hospitals and physicians to provide around-the-clock care, which is so important.
So when we talk about remote patient monitoring, what type of patients are you looking at? Only like in clinical studies, talking elder care? Where are we at in that space?
So we're looking at different types of applications. So one of them is elder care. Second is disease management. Third is chronic care. Fourth is transition or post-operative care. And then we have a market in clinical trials, how to use remote patient monitoring to automate clinical trials and make them more efficient.
Very neat, very neat. I can tell you, my parents, right, getting older, up in age, right, things like, are they taking the medication or what medication are they taking? Hugely important. My poor sister, she's involved every week. She'll go to my dad's house, make sure, the pill cases, the Monday, the whatever, right? Yeah. So, I look at remote patient monitoring is something solving. Is that kind of where you're going with that solution?
Absolutely. That's a great example, Kevin. And my parents are also elderly, and sometimes they take medication and sometimes they forget to take medication. So with remote patient monitoring, it's you can monitor the patient in their home or a less expensive facility. And the monitoring is around the clock. And you can try to solve issues of drug adherence.
Yeah.
You can monitor the patient's vitals, on a real-time basis. And whenever there is an excursion or an alert, then the clinician or the caregiver is notified about it. For example, your blood sugar may be way off, or your blood pressure may be way off, and the clinician is notified, and then they can start managing the patient immediately instead of waiting when there could be a risk of potentially fatal outcome.
Wow, all those things are hitting home for me, right? My father lives alone,
Yeah.
right? So you don't really know what's happening. He is a diabetic, right? And blood sugar, and when I see the guy eat chocolate cake, I cringe, right?
Yes.
Wow, would it be amazing, as a big fan of IoT, right, to see those type of sensors and solutions just help solve problems.
Yeah.
Amazing, amazing. Tell me more about the problem, because I see it only from a patient point of view,
Yeah.
right? And patient being my father, myself, my family, right? Yeah. So tell me about the other folks involved, because it's hugely expensive from a healthcare, right? Everyone knows that.
Yeah, yeah, for sure. So let's talk about that. Remote patient monitoring can actually help solve the problems with all 4 Ps, what we talk about, which is the payers, the providers, the patients, and the pharmaceuticals.
Oh, wow. Wow, I only see it from one point of view, but you're
Yes.
right, all 4 involved.
Yes. So, for example, if you look at payers, right, the payers can save, just by reducing preventable readmission, about $17 billion per year.
Wow,
And
that's huge.
Yes, that's a very large number, a very large saving. Now, if you look at the patient, right, side of it, patients sometimes take drugs and sometimes they forget to take drugs. So that
Certainly.
so the non-adherence to medication is a huge problem. And there are 125,000 deaths per year due to non-adherence to medication.
Oh my gosh, so to state that differently, when my father forgets to take medication, right?
Yeah.
That's wow.
Yeah. Yeah, so this is...
I don't want to be one of those.
I know. So this is very serious, you know?
ma'am.
Yeah. And then let's talk about the pharmaceuticals, right? For typical pharma, it takes 10 to 15 years to discover a drug and bring it to the market, right?
Oh my gosh.
And about $8 million per day is a loss due to delay in releasing drug to the market due to inefficient clinical trials.
Oh, wow.
Right?
Wow.
So you can see all this is adding to the healthcare cost. So these are some of the market dynamics which are leading to adoption of remote patient monitoring solutions.
That totally makes sense to me, right? Being a fan of IoT, right, we always see the temperature stuff, but here we're really making a difference. So you tell me about the 4 Ps. This sounds a little futuristic, I have to be honest with you. Where are we at from an adoption and deployment of these kinds of solutions?
So the global market for RPM system is slated to hit $24 billion by 2020.
Is that a billion?
Yeah, it's a B,
Wow.
a billion.
Wow.
And some of the key reasons promoting such large-scale adoption are an aging population, the baby boomer aging population, who are susceptible to chronic illness. And they require timely diagnosis, continuous monitoring, and prompt treatment. So that is one of the key reasons why this would increase adoption. The second reason is a shift towards a value-based, disease-specific payment model to offset the rising hospital-based treatment costs.
Okay, so help me understand that last one, right? As I said, you are a doctor, I am not. When you said value-based, help me understand in layman's terms, right? Because I get the patient portion.
Yeah, I mean, it's if you look at outcome, right? So for hepatitis C, there's a certain outcome. For Alzheimer's, there's a different type of outcome. It's a different disease. So coming up with the disease-specific treatments and looking at the outcome of these treatments, that is what is one of the things that will drive the IoT applications. And another reason for the adoption is a need to cut down instances of hospitalization and readmission. And we've talked about this quite a bit, right? Anytime there's readmission, the cost goes up, right? So how can you prevent readmission, and try to provide the treatment in the patient's home and do a real-time monitoring so the risk of readmission can be lowered. Yeah.
So a little deeper there on the pharmaceuticals, right? How's that helping them from that point of view, right? From a market from an adoption perspective?
Yeah, I mean, if you look at pharmaceuticals, we go to drug development, the research and the drug development, the clinical trials, right? And we talked about the cost of a clinical trial, right? And there is a lot of inefficiencies in clinical trial. It's a paper-based system. It's the sample number of patients who are basically, recruited for the clinical trial. They have to come to the clinic for periodically.
Oh, yeah.
So, and there's a lot of drop-offs, right? Because not everybody is able to come to the clinic all the time, right? So there, if you look at an IoT device, like a wearable device or a blood pressure meter, blood glucose meter, and things like that, wearable device where the patient can be monitored from home and not have to come to the clinic all the time to be a part of the trial. So that is how we will remove the inefficiencies, some of the inefficiencies, and manage the cost of this clinical trial, bringing in more automation, bringing in site-less trials, and such as that.
So this is the first time we've discussed devices, and you're right, wearables are now starting to become all the thing, right? Everyone has some kind of a smart watch or beyond, right?
Yeah, and the proliferation of these IoT devices is another reason that we believe that the adoption of remote patient monitoring would really take off and be mainstream in a few years.
And that's a reason for now, right? Because these devices we're talking about were not prevalent in the past, right?
Yes.
So I keep thinking, what's changed? Why is it different? Why this? Why now? And it seems like a lot of things are converging.
Yes.
Right, the cloud capability, right, amazing. The device is amazing, right? The what we call AI or machine learning, all those kinds of words. I don't want to get too technical, right? But those things make this a reality and cost effective.
So what I'll talk about right now is HCL's remote patient monitoring solution. It's a HIPAA-compliant solution, which is built leveraging HCL's capability in engineering and research services in the medical device industry and our domain expertise in life sciences and healthcare. The remote patient monitoring solution is based on Azure cloud platform using Azure services for receiving, unpacking, processing, and storing the data, as well as directing people, such as clinicians, to take event-driven actions.
Oh, wow. So it's really bringing your domain expertise, that kind of area, and using a great cloud service like Azure and making it real, right?
Yes.
So that's amazing. So Microsoft really helped in that area. I mean, from a HIPAA perspective, right? We talked about that, right? With some of the accelerators, or how were you able to kind of bring that to market? Was it just, what was the secret sauce?
Yeah,
of the Microsoft platform?
We looked at many different platforms, and we selected Azure due to its comprehensive set of cloud services that our developers could use to build, deploy, and manage applications. Azure just makes it so simple to develop this solution, and it provides the scalability, security, and privacy features that are necessary for this
Amazing.
solution.
Glad to hear that. That's been our goal, and it's amazing to hear partners that take that to reality. We talk about HIPAA and being a U.S. citizen. I think about the world from a U.S. point of view, but tell me about a global deployment, global presence. How does this work across the world?
That's a great question, Kevin. Thank you so much for asking that. If you really look at it, Microsoft is a global company, and so is HCL. Our customers are all over the world, and our solutions need to work all over the world, right?
Certainly.
But then there are different legal requirements with patient privacy, patient safety in different countries, right? And what we do is that our solution, when we deploy it in different countries, we look at it by case basis.
Oh.
What are the legal requirements, say, in Germany versus what it is in Singapore, right? And we will tweak the solution to meet those requirements.
That makes a lot of sense. I know from Microsoft Azure perspective, we look at compliance across all the countries, but not necessarily the healthcare. That's not our strongest push, right? We deal with financial, all kinds of things, right? So that totally makes a lot of sense, right? Per country, you figure out what it takes to function in that world, and you make it happen. Love to hear that.
Exactly. Thank you.
And we show some devices here now, right? So tell me about what the devices might be doing and some of the vitals. See, I'm learning here that they could be picking up on and that you've delivered so far.
Sure. So the vitals are collected from various devices such as blood pressure meters, weighing scale, glucometer, and the data that is coming out of the vitals is processed in the Azure cloud based on a HIPAA-compliant platform to deliver the right information to the clinician. And to provide additional flexibility, the platform supports what you call as bring your own device model, which allows us to integrate the Azure HCL platform with the patient's or clinician's existing devices.
Oh.
So there may not be a need for them to go buy new devices.
Oh.
And a little bit more about the solution is that, we have used various components of Azure in our solution, such as the IoT Hub, which is used for ingesting the data from the vitals into the backend cloud. And it's a bidirectional communication. It's beautiful to have the IoT Hub do a lot of the heavy lifting. And then we go into the Stream Analytics, which processes the data, because this is all about large amounts of data that is being collected.
Yeah.
And then from the data, the data is compared with the settings of the clinician. The clinician sets the threshold value at which he or she wants to be notified. So once it reaches a notification level, then through the Event Hub, the notifications are sent to the clinicians. And now, today, healthcare, providing care is becoming more of a ecosystem or a care team type of a place. So the notification can be sent to, say, in case of your father, to you, to your sister, to the doctor, or maybe to a close group of friends. Hey, your blood pressure is way out of the normal. Please do take a note of it. What can you do about it? And then everybody, who is near and dear to the patient knows about it, and then able to take some actions. So this is how we have used the technologies in Azure to bring a solution.
Tell me more about where HCL is going in this scenario.
Our customers like the solution a lot, and they have...
I see why.
Yeah, and there are different types of application that they're considering. So some of our customers are looking at it to automate clinical trials, because that work has already started in the industry. Customers realize the value that this solution can bring to bear in reducing the cost of clinical trial and improve the efficiency. So there is definitely a lot of interest and work going on in that area. Another area to look at is measuring the efficacy of a drug. For example, you may have the latest and greatest cancer drug in the market for to treat patients with cancer. And then, once the patient is on this drug, then you use remote patient monitoring to actually monitor the patient who are on this drug and see how they're doing.
Oh,
right?
Yeah.
So it's about measuring the efficacy of the treatment using RPM. So that's another area where our customers are seeing a lot of value with RPM.
Tell me more about IoT Works. Love the remote monitoring. Great stuff. Tell me about your next solution, what you have in store for us.
So the next solution that I would like to talk to you about is what we call Reserve. It's remote services and remote monitoring of assets.
Oh. Of assets?
Yes.
Okay, great.
So these could be assets in the hospitals, such as your MRI machines.
Big assets.
Big assets.
Okay.
Yeah. It can also be assets such as your point-of-care devices in the hospitals and emergency rooms. So all different kinds of assets that you can think of. Another example of a great asset is cardiac programmers. Basically, if you look at that market, the patient goes to the hospital, gets an implant, and then periodically that implant needs to be reprogrammed and adjusted.
Okay.
And there are programmers which the service representatives have, and they actually use that to program the implant device. So that's another place where the solution can be applied to monitor the condition of those programmers. Are they in the latest and greatest update stage, and can it be done remotely instead of always having a person go and do the updates? Because these are field devices. They are scattered all over the world.
So when I think about going into a hospital room as an example, right, there's a zillion devices. I'm assuming that's why it's so expensive, right?
Yeah.
Surely they're already monitored right now. I mean, they can't just buy something, forget about it, or is that really what's happening today?
Well, I mean, they're monitored using paper. Okay, that
doesn't count.
Yeah, this is a real-time monitoring platform. So basically, what would happen is these assets will all get connected, and connected with sensors, so just that their location and their condition would be real-time monitored and brought into Azure platform, the data, and then remotely we monitor these, where they are and what condition they are, maybe what software revision they are on. Are they in calibration or out of calibration? So all those things can be monitored, and then actions can be taken based on that.
Wow, that's amazing. When I think about calibration, I think back to the surgical instruments, right? And
yes.
I can tell you, when I think about that, I want it to be calibrated as much as possible. I don't want to miscut or misunderstanding.
Yes.
So I totally see the value in that area, right?
Yeah.
I'm a little bit surprised that it's taken till now to that to come into place. But when I think about IoT and the wireless kinds of stuff, all the things that are happening there, it does make sense. So I understand more and more about the why now, and how we can deliver that with IoT.
Yeah, I mean, one thing to remember is this type of solution will actually help lower the cost because you will know exactly how many devices you have and not over-purchase devices, right? Just
That's
to
huge.
compensate for it. The other thing is that you know that if an MRI machine goes down, you have to cancel all your appointment, reschedule it. There's so much downtime. There's lost revenue when a machine like that is not functional and operating, right? So with this type of a solution, you can take it to the level where you actually start monitoring a large machine and the health of that machine. And you're able to predict, that's where the predictive analytics comes in.
Oh.
When is the maintenance needed on this machine?
Yeah.
Or is there a red flag from the data, the sensor data that is coming in, that the machine is about to fail? And then you take the requisite action to keep this machine running, decrease the downtime, and increase the uptime, right?
Wow.
So that's also a feature that is built into this platform.
Great. As I mentioned earlier, just from the patient point of view, I don't see any of those things. But you're exactly right in the fact that there have been appointments I've had.
Yes.
Right? Had to be canceled for one reason or the other, right?
Yeah.
Machine not available, under maintenance, all these kinds of things, right? I definitely see that. And from a whole different point of view, you're right, understand what assets I have out there.
Yes.
Right? Do I need more or less just to deliver those kinds of capabilities? Again, as a patient side only, I don't think about those, but when you think about just running any business, right, you're limited by the assets you have on hand.
For sure.
That drives the value that I see totally
Yeah.
in that solution.
Yeah.
Great idea. Great idea.
And the other thing to look at is you decrease your service cost, right?
Yes, I could see that.
Yeah, because you're doing this more from using the Internet of Things and not people. Right, people are not doing the servicing as much as monitoring these assets, using IoT, and then you can also do your field service optimization. You may not need 50 field engineers. You can probably go with 30 or 25, right? Yeah. Because now you're doing remote monitoring. And one of the features that is built into our solution is a very differentiated user experience. So this is critical because when you're sitting in front of a computer and looking at all your assets, right, the user experience becomes important for adoption. So can you group them by assets? Can you filter them by certain assets, right? Yeah. So that there's a really good amount of user experience built in, which can be tapped and makes this particular platform very user-friendly and interactive with the technician who is working on it.
Certainly, and we've seen that throughout time, right? Usability, right? You may have the most amazing widget or technology solution, whatever, right? Not usable, right? Adoption is going to be poor.
Yeah.
Right? So yeah, I totally get that. And that does make a lot of sense there.
Yeah.
So walk me through the rest of it.
Yeah. And it flows into the Azure platform. Again, we
love it.
We have selected Azure for this solution. And the data is processed in Azure, and then actions are driven out of this data.
Okay.
So mainly if you look at some of the features of this platform, it's for asset monitoring. Anytime there is an asset and you want to remotely monitor it, you can do that with the Reserve platform to optimize the downtime and to increase the uptime of this asset.
Great, great. So I think I understand the flows of it. Let's go a little deeper in the technology, because I'm a nerd by heart.
Yeah.
Right? So let's go into some of the architectural stuff, right? So we'll kind of show some of those.
Certainly. Resurf is based on Microsoft Azure Cloud Platform, and it can connect, the devices can connect to the platform using various protocols like HTTP, MQTT, and others, and it can communicate directly through the gateway. Again, the IoT Hub was chosen here as the gateway to basically help with data ingestion and bidirectional communication between the devices and the cloud platform. Now, the device data is processed and analyzed in real time using Stream Analytics, which stores the data in the storage layer. And there's a really bunch of cool core business service layer, which is based on microservices-based model.
Nice.
And they have services for customers, device, firmware management, notification, authentication, et cetera, and more services can be added on because it's microservices based without having to redo the architecture. There's an admin portal which allows the dashboard features and access control, configuration, and others. So that can be used for admin-related activities and visualization.
Certainly. So looking at this slide a little in detail, right, I see the RS-232 port, right? So that kind of helps me understand how you are, I hate to use the term retrofitting, that's really what we're doing there, right? You're taking serial data, a technology been with us forever, right? And kind of IoT-ifying it, right? So you do get the data. That really helps drive home how you can retrofit, as I said earlier, non-smart devices, those devices that weren't meant for this, right? So
exactly.
great point there. So great, we talked about the architecture, I'm a big fan of that, but let's pivot on security for a second, right? How secure is this? I don't think serial is that secure, is it? How are we addressing those concerns?
I mean, security is a very, very important aspect of IoT, and it is a crucial aspect for device management. And in the Resurf solution, we have taken care of it in several different ways. One of the ways we are doing it is device authentication using a token.
Oh, yeah.
So I'm sure you're familiar with that technology, so we use that. Security tokens are very unique per device, and that is generated by the Resurf platform, and it's used for authentication of the device.
Nice. Let's summarize just some of the benefits of Resurf. Can you walk me through that?
There are so many different benefits of Resurf platform and Resurf solution. So one of the things is that it helps to streamline operations, and then it provides better patient care. Really, if you're looking at it, the patients can schedule appointments. They know that definitely those appointments will be met. If you're in a critical stage in a hospital, you know where the location of the hardware and the equipments are and the devices are, so that the patient can get timely care. Then the other area is really field service force optimization in maintaining these large capital equipments. You can optimize it by not having a service technician come in all the time whenever the machine is down. You can just remotely monitor it and be able to get the condition, the health condition of the machine, and adequately disperse your technicians to take care of it. The other area is it maximizes device uptime, because you're able to real-time monitor it, you're able to do predictive analytics on the health of the machine, and you can maximize the device uptime. A very interesting benefit of Resurf platform is the differentiated user experience that HCL has created for this platform. It gives multiple views of different machines by different categories, and filters the data that you want to see, because the data, there's so many equipment, so much data there. You're able to filter it, you're able to see what you want to see to make what is most valuable.
Great solution, appreciate the information. If partners and customers want more information, where can they go to find information?
Thank you, Kevin. They can actually find a lot of great information about HCL IoT Works in our website, which is shown in the screen. I encourage our partners and customers to visit us in our website.
Excellent. Thank you so much, Aditi. Appreciate it.
Thank you, Kevin. It was a pleasure to be here today.
Next up, we're going to be hearing from Cameron Carr. Cameron is the Director of IoT Strategy Solutions and Scale at Microsoft. Welcome, Cameron.
Good to be here.
Great. Tell me about yourself, what you do for Microsoft.
Sure. So as you mentioned, I'm the IoT Director of Strategy Solutions and Scale. And what we do is we focus on things where there is no specific customer. So how can we help enable anybody who's out there, whether you're in a garage, all the way up to a global multinational corporation. So really it is a scale motion.
Very cool. So interesting charter. Tell me what trends you're seeing from customers and partners and how they get started in that area.
Sure. So I think in general what we're seeing is there's a lot of different issues around IoT and why it hasn't scaled to the point where it will in the coming years, and it's kind of starting to get there. But the areas, I think you can bring them down into two major areas. One is complexity.
Yeah.
You know, it's very difficult to create, deploy, and stitch together an IoT solution. And then secondarily, kind of the lack of clarity and vision and things of that nature when you're kind of early in the marketplace. So it's a little bit concerned about what does it look like for your business? How are you going to make money? I've never done this before.
Yeah.
And you put the complexity on top of that, and it's an issue.
I totally get it. I hear that from my customers all the time, right? In a new business venture, right? How they monetize it, right? Make money from it, all kinds of scenarios. You're right. It's a whole new world, right? What are we doing at Microsoft to kind of help the partners and customers go down that path?
So we have a few different ways that we can do that. So through my team, we have a platform where it will allow you to do two main things, which is invest and develop. So we work with a program that will allow companies who are trying to develop on our platform to move forward quickly. We invest by working with trusted system integration partners that we know understand IoT.
Oh, yeah.
We help vet and give you partners that are good within that industry and that we have a process with to make it quick. And so they come in and help you to actually design, develop your solution, and then people like yourself are involved in that program where we help them to design that vision as part of that. And then secondarily, we have the develop piece of it, which is what we call solution accelerators. And so what those are essentially are open source vertical reference designs for IoT.
Okay.
So as we've kind of seen over time, the process of creating an IoT solution from scratch, there's a long time in the very front piece of it.
Certainly.
Yeah. And that you don't really move forward too much in that first 9 months, if you will. Those reference designs will help you to get past all that and already land at the pilot phase, where you have a set of capabilities that you can build on top of.
Great. So in the developing side, and we're talking about the accelerators, I'm a little familiar with the program. How do we help partners who have great solutions or concepts or ideas kind of come to market?
Sure. In terms of coming to market, we have a few different ways that we go about it. We have what we call solution maps, so we can help our partners once they actually get a solution into market. We can get them into the solution maps internally to Microsoft, which activates the 22,000 plus sellers that we have going into enterprises every day.
Yeah.
So that's one way, and then we have smart city initiatives is another way. Where if we find the right solutions with our partners, we bring them into large RFPs and engagements in a smart city scenario. So there's a lot of opportunity there as well.
So you mentioned investment. Help me understand what the investment looks like from Microsoft, and how do we invest to ensure the success of our partners?
Sure. So, I think as Microsoft, we realize that we ask our partners to take, a big leap in going into IoT with us and using our platform. And so we want to also invest in that. We want to also help take part of that leap. And so we invest in our partners who are developing our platform, as I mentioned, through SI partners who we actually help or pay to come and put fingers on keyboards, help you develop your actual solution as well as the vision. And then we have other resources like cloud solution architects and people like yourself that go in and help clarify that vision as well. So specifically we invest in our main 6 categories.
Okay.
So that's energy, retail, factory or industrial automation, security and surveillance, healthcare, and smart buildings.
Oh yeah.
But of course we're looking for any sort of great technology as well, So that's the main areas, but we can invest across a range of areas. And then, we invest in stages. So wherever you're at in terms of your deployment or your process, we have a spot for you to slot in and then a path for you to get to success. So whether you're in envisioning, POC, pilot, we have a way to get you to the next stage.
So yeah, great from a partner perspective. So how do we deliver these partner solutions? How do we deliver these repeatable solutions?
Okay, well, so on top of the investments, you know, we have, as you mentioned, the solution accelerators.
Yep.
And so what those are the open source kind of reference designs that are vertically focused.
Yep.
Okay, and they, so you would have, for instance, a healthcare example of one of those. And so we build in an extensible framework, and it's sort of an 80% finished solution. You know, we know that we don't want to have, you know, people aren't going to want to have the same technology as everybody else is out there, right?
Yeah.
So we just take care of the underlying framework and the plumbing that is kind of the same across all the solutions, all the kind of use case scenarios that you want to go after, and then leave that 20% of the real value to your customer that is facing them and addresses their specific challenges for the partner to develop on top of and make it their own.
Certainly. So I've been at Microsoft a while, and we've always kind of taken that approach, right? That 80%, right? The plumbing, great example of wording, but it doesn't mean that every customer or partner solution is the same, right? You expect that 20% of unique to that customer, right? So let's take IoT as an example, right? You ingest data, we get that.
Yep.
You land or store data, we get that, right? You do some basic analytics stuff. You know, those are probably common to most everything, but what it is they do in like healthcare versus manufacturing versus, you know, all the other ones, right? That's that other 20%. Really a focus area for partners. And when we look at someone like HCL IoT Works, right, their 20% is focused in that area.
Right.
Right. So, and we have lots of partners. That's just one example in that area. So, great example, great scenario, kind of how you're driving on that area.
Yeah, thank you, and absolutely. And then also, you know, just to go a little deeper on that point, there's also the partners that are within the same vertical, and they have their own differentiation across their specific partners as well. You know, so for instance, again in healthcare, you have that underlying layer that you talked about. You want to connect a device. Obviously, you want to see some data and telemetry coming off that device. But then, you know, you have a healthcare partner that's looking at patient recovery or outpatient care.
Oh, yeah.
You know, they may be looking at specific biometrics and monitoring that so that they can prevent you know, cardiac arrest or have a early sense when someone has had a surgery that they may have to go back in for another one. And then there may be other partners who are looking more at testing for drugs, or they may be looking at in-hospital care, or there may even be just more specific telemetry off of an EKG device or something of that nature in a hospital setting. So we kind of help them you know, differentiate across all those areas as well.
I think that's hugely important. When we look at, you know, we use the term transformation, you know, all the time, right? And it's interesting, but that last 20%, I would argue, is a transformative part, right? There's no value in installing an OS, right? That's interesting. It has to be done, but that's not what transforms the industry. That's not what EKG readings and preventing and predicting and those kinds of scenarios, right? You know, so I would say the magic's happening in that 20%, that partner space. Very interesting.
100% agree. I think that's what we're seeing, and we try to enable the partners to get to that place faster.
Yeah. So great. Kind of evolving a little bit. Tell me more about the different components of the solution.
Okay, so as part of the solution accelerator work, it's a full solution approach. So it's not just the software or the back-end architecture or anything like that. You get sort of the full suite from software to hardware to actually how do you think about running your business on this and making money and marketing materials. So you get technical documentation that will allow you to understand, you know, what you're downloading and how to implement it. Then there's the actual code itself. So you're getting the code that would lead you up to, let's say, an ARM template, which is an Azure Resource Manager. So it can automatically spin up the types of resources that you need and connect them in the way that so that they work. And then there's also, you know, the portal itself. If you want, as part of this healthcare example, for instance, it's pointed towards a provider that is looking at home healthcare scenario. We might include a portal that is focused towards, okay, here are all of my my patients. I can click in to see the biometric data, the things that someone in that industry kind of cares about, and you kind of do that plumbing for them. Then there's some device lists. So as part of these pilots that we end up doing with these, you know, before we release them, we tested with various devices. So we say, hey, we know these work. There are millions of other devices that might work, but we know these work. And then this deployment strategy. So for instance, in the home healthcare scenario, if we were looking at monitoring someone through video, if you have an elderly parent and you want to make sure that if they fall and they're not getting up quickly, there sends an alert. Well, you might say, hey, we realize you need to put cameras in this type of location for it to get to work properly. So IoT is about bringing the real world into the digital.
Yeah,
so
certainly.
You kind of have to learn about what happens in the real world and give insights there. And then finally, it's the go-to-market and sales playbooks that we also help you with.
Anything else you want to add in the solution approach?
Yeah, I mean, I think the final thing is that it's really all about helping our partners to get to market faster and enable them to achieve more. And part of the way that we do that is these solution accelerators are not developed first party by Microsoft. We work with SI, system integration partners, to do that. And then in the event that the partner also needs help to create their last 20% and do all that, we have ready-made partner there that's very familiar with the solution to help you get to that extra 20% as well.
Great content, Cameron. Appreciate it. For our partners and customers out there who want to know more about this, where can they go to?
Sure. So there's some information on the screen. We have the Device Partner Center platform that will help you to understand all the components of the things that my team and other teams throughout Microsoft provide for this type of thing. So you go to the link on the screen, you can and get more information. And then finally, you can also email our team directly if you're looking for specifically solution accelerator information.
So great information, Cameron. Is this a U.S. only program?
No. It's the Solution Accelerator program is designed to be global. I think right now we have investments in over 25 different countries at this point. Yep. And then with the actual individual accelerators and the technology work, we have those globally available. To a certain extent, they're open source, so we don't necessarily know where they go, but I think anyone with a computer can access them.
Yeah, well, I guess when you think about it, right, Azure being a global platform, right, someone in Asia, some country, right, they could be deploying stuff, maybe originally written for the U.S. or U.S. mindset intended, back that 80-20, right, they're making the modification to deliver the capability in their country. Makes a lot of sense there.
Absolutely.
Great. So that concludes today's industry webinar focused on health industry solutions. You heard from Gareth Hall, Microsoft's Health Industry Director, talk about intelligent health and how digital transformation across this industry is critical to improving well-being around the world. We also heard from Dr. Aditi Banerjee with HCL IoT Works, one of our key healthcare partners, who explained how their solutions, remote patient monitoring and services, can reduce costs and save lives. Finally, Cameron Carr discussed the Solution Accelerator program that can help both customers and partners accelerate their IoT projects with a pre-built design architecture and potential investment opportunities for partners to help design and build solutions. We hope today's industry-focused webinars was of value to you. We have several upcoming webinars on energy and agriculture, plus many more. You can watch past webinars available on demand by following the URL on this slide. Be sure to also check out the new business transformation videos available on demand. You'll hear from industry experts around workforce transformation and how to supercharge your P&L. Thank you again for joining us and have a great day.